Hi, I'm Laura Siminoff, Dean of the Temple University College of Public Health. Joining me are our faculty experts, Graciela, Jaschek, Sarah Bass, Krys Johnson, and Heather Murphy. We had some good news recently. There are two vaccines that are headed for approval and use in the United States. And one is manufactured by Pfizer and the other by a company called Moderna. Both use the same platform to create the vaccine. We're here to break that down for you and hopefully provide a greater understanding of the vaccines. So, Graciela, good to see you. Hope everybody had a great Thanksgiving, safe Thanksgiving. I'd like to start off by having you give us an explanation of the different ways a coronavirus vaccine can be made, and then maybe a little more explanation about the vaccines made by Pfizer and Moderna.
Sure. Laura, a vaccine is necessary because the novel coronavirus spreads easily and can cause serious disease and death. While some people may experience mild or no symptoms at all, some are at higher risk of developing severe disease and dying, and others can experience symptoms for an extremely long time. So in the absence of effective treatments and or cure, vaccines are critically important to stop the spread of COVID-19, serious disease, and death. There are currently 55 vaccines being tested in clinical trials, and there are 87 in preclinical trials with animals. There are 4 major types of vaccines that are being developed, and I'm going to talk about them. So the first are inactivated or weakened coronavirus vaccines, similar to the polio or measles vaccines. The second are protein-based vaccines that contain pieces of viral protein, like the spike protein, that are packed in lipid nanoparticles. The third type are viral vector vaccines, in which a virus that does not cause disease carries some coronavirus genes that either start making copies or start replicating to make some coronavirus proteins, such as the spike proteins again. And the fourth, and the most promising and exciting vaccines are genetic vaccines that deliver messenger RNA or DNA directly to the cells, immediately provoking an immune response. Until large clinical trials are conducted, we will not know which vaccines are likely to work. The development of genetic or messenger RNA vaccines, such as the Moderna and the Pfizer vaccines, seem to be progressing really well. They have demonstrated 95% efficacy at protecting against developing disease under ideal laboratory conditions. They are also promising vaccines because they are easier and faster to produce. However, they are constrained because they need a second booster dose and they need to be stored at very cold temperatures, which makes shipping and storage difficult in some settings. So in summary, while important progress has been made and the Pfizer and Moderna vaccines are really promising, vaccine development is still ongoing, and we look forward to additional scientific research that will tell us how the Moderna and Pfizer vaccines will behave under real-life conditions, how they will be made readily available to all risk groups, and also how people will embrace their use.
Krys, can you explain how we know that a vaccine, in particular these two vaccines, are safe and effective?
So to get at the safety aspect, the vaccines actually go through 3 preclinical phases and then an additional 4th phase, which I'll discuss and is more like what Graciela just spoke about. So in phase 1, they're just giving the vaccine to a very small group of people to see if it creates an immunity in them, and then people are exposed to the virus to see if they are able to fight it off or have very mild symptoms. In phase 2, they actually vaccinate people who are in demographics of interest. So older folks, people who might be more likely to have a poor outcome, like immunocompromised folks. In phase 3, though, they actually include tens of thousands of people, just like what we just saw the data come out of for each of these vaccines. And in that scenario, people are not actually actively exposed to the coronavirus itself after being vaccinated. They are vaccinated and then told to go live their daily lives. And then they look to see if they develop immunity, and then how many of those folks develop coronavirus and then severe COVID symptoms.
So for the phase 3 trial, which is the piece of the trial that right now they've reported, and that on the basis of that they're giving emergency use. About how many people participated in those trials? Like, how do we know?
So in each of the ones that I have looked at the data for, there have been tens of thousands, I know upwards of 40,000. So they've tried to be very comprehensive in making sure that they have an appropriate sample size so they can see hopefully everything that could go wrong to make sure that it is safe, as well as being effective in creating that immunity.
Okay. And then my last question to you is that I know AstraZeneca and Johnson & Johnson trials at varying points were paused. So could you explain to people what it means to pause a trial? Why would you pause a trial?
Right, so pausing a trial, particularly a vaccine trial, is according to protocol. So anytime there is some severe potential side effect or severe event, it could also be someone's death, then vaccine trials are paused just to make sure that it's not related to the vaccine at all. So it could be that a person had a heart attack, they had a diabetic incident that is completely unrelated to the vaccine itself, but out of an abundance of caution, it's protocol to pause trials just to be sure that it's not related to those vaccines.
So Heather, can you tell us a little bit about what it means when you get vaccinated? Does it mean you can't contract the virus or spread it to others? What's the implications for people who are vaccinated?
Yeah, that's a good question, Laura. So when you get vaccinated, it means that if you were to come in contact with someone who has the virus, you're less likely to become infected with the virus. And if you did, you would likely have a milder immune response, or in other words, have a milder case of illness. What the vaccine does, it allows you to help fight off the illness more easily. However, at this time, researchers don't know how long immunity from the vaccine will last for, and therefore, after receiving the vaccine, it's unknown how long you will be protected from contracting the virus or spreading it to others. Also, no vaccine is 100% effective. Therefore, there's still a chance that your body might not produce an immune response when you get the vaccine, and then you could still contract and spread the virus. In addition, researchers don't know if the vaccine will prevent asymptomatic infection, meaning you're infected and can still spread the virus but are not ill. So there's still some unknowns related to it. And for the vaccine to be truly kind of effective for the population, we need to achieve what we call herd immunity, where enough people get the vaccine so that we don't see it, the virus spreading in the population as readily. And we're actually not even sure what that herd immunity number is, like what percentage of the population needs to be covered.
So finally, Sarah, there are many people, in fact, almost half of the American public, who says that they're not going to get vaccinated. I just heard that 75% of Black men say they will not take the vaccine because they think it's some sort of experiment. So what do you think is at the root of this vaccine hesitancy, and how can we counter it?
Yeah, I mean, I think vaccine hesitancy has definitely become an increasing threat to public health. And we're seeing it obviously here as an issue with upcoming coronavirus vaccine. What the issues of why people are hesitant are just kind of starting to be looked at. Most current vaccine hesitancy research has really just been done on parents, and less is known about how adults feel about getting themselves vaccinated, and the kind of what the hesitancy is around this potential vaccine prior to distribution. One way to look at it is to think about how it fits in our worldview. So the World Health Organization, they have a thing called the Vaccine Communications Working Group, and they kind of have proposed what they call the 3 C's model to explain vaccine hesitancy. One is confidence, which is defined as kind of trust in the effectiveness and the safety of the vaccines. The second is complacency, where the perceived risks of vaccine preventable diseases are low. And then the third is just convenience, which is kind of defined just as the physical ability and ease at which vaccination can happen. I think in the case of COVID, it seems that most of the main issues fall in that first category of confidence. So some of the preliminary studies suggest that anywhere, as you said, from, some are lower, 20 to 50% of the overall population is unsure about getting vaccinated. Most importantly, I think, as you alluded to, those who are most likely to say they don't want to get vaccinated are actually also those who are most at risk of getting COVID and actually dying of it. So especially African Americans and those who have lower levels of both socioeconomic status and education level. It also seems that it's true that those who are younger, who are actually the most likely to get to have asymptomatic and give it to those at risk, are actually also hesitant. And I think for African Americans especially, a lot of this is driven by mistrust of the healthcare system, the government, and kind of fear that they are being experimented on. And honestly, those are many of the same factors that drive other types of health disparities. I'm part of a team that did a survey with adults in New York, Miami, and San Francisco, and we found some of the same demographic factors associated with vaccine hesitancy, but we also looked at things like satisfaction with health and healthcare access, and we found that people who were more dissatisfied with their own health and their healthcare access, as well as those who said they were not paying attention to COVID-related news, were also less likely to say that they would be vaccinated. So I think it's a potent group of factors that are driving a lot of this to be hesitant. What do we do about it? Most estimates are that at least 75% of the population probably needs to be vaccinated if the vaccine is at least 80% effective. And as Graciela said, we don't know how things are going to work out kind of in the real world test. So we definitely have our work cut out for us to get more people to feel comfortable. Part of it, I think, is just really addressing these concerns in populations at risk. We can't just tell people that their concerns aren't warranted because they have real life experiences that say otherwise. And we have to have people from the community who are trusted talking about it. So not just celebrities. So it has to be people that other people know from their neighborhoods or their communities. And I think most importantly, we have to be totally transparent about the vaccine. So about its side effects, about how it's administered, about how certain people are getting it first, to help kind of restore some of that trust in science that's been taken away and, really taken that beating in the last 4 years. And so, I would say hopefully as the vaccine is rolled out to healthcare and essential workers first, the public will start to feel more comfortable about getting it. But really time is going to tell. All we can do for now is to keep talking about why it's important.
I think that's a really good point. And hopefully as the public sees that healthcare providers are taking it, they'll be more willing to do so too. So thanks everybody for joining us today. I just want to say that many people traveled this week and visited family and friends for Thanksgiving. If you did, please consider getting a test and or remaining isolated for the next few weeks. Remember, 40% of people who have the disease show little to no symptoms, so don't be a spreader. To view other videos and find links to reliable sources of information, please visit us at cph.temple.edu/coronavirus. Thanks.